So around the world at the moment, there's a huge amount of activity in human genomics, and there's tens of thousands of human genomes being sequenced now around the world in various different contexts and in research studies, but also in clinical settings now in the private sector and the public sector. But one of the common trends is the need for data sharing, and the rarity of each genetic variant means that it needs to be interpreted within the context of a large population. However, there are barriers and challenges in actually sharing genomic data. And so I know you think a lot about this. So how do you think we can move things forward in human genomics to facilitate data sharing?
Yeah, I mean, that's a crucial question, I think, because with the genomes that we have, I mean, of course, they're powerful for Swedish genomes, but I mean, the world looks different now. I mean, people are coming from different countries, and sort of we need to have global efforts to try to collect all of this information. But we then have problems as well. I mean, each country has their own legislations, and how do we do this in a good way? And it's still not solved. But I hope that we can try to work together and find solutions that makes it possible to share this information between each other.
Yeah, I think some of the barriers are the consent and the ethics of the sample collection, whether that individual knows and is comfortable with their genetic information being shared around the world. I think some people would be happy about that if they know it's leading to medical research. Other people might not be happy with that. There are some issues around data security and privacy. The world we live in today is a digital world, and there's always the possibility that information that's out there can be got hold of. And then there's also some, I guess, more selfish motivations in people trying to drive their careers through keeping data to themselves. And then there's informatic challenges with actually dealing with these huge data sizes and how to make that data available more broadly in terms of informatics. So I know that your project in Sweden and also our project here in Australia, the funding was such that it was part of the deliverables of the project was that it had to be made available to the broader research community, and that was kind of the whole point. So can you tell us about how you've done that in Sweden and the uptake so far?
Yeah, I mean, that's something that we have been working on from the very beginning in this project. So we knew that there was going to be a high demand for getting access to our data. So we already from the beginning, when we started up the project, started also to build the infrastructure to share this information. But the actual sequences that we have now for each individual, they reside in a compute storage, which is more or less locked down from the outside world. Yeah. So we don't have internet connection. We need to work within this specific environment if we're looking at the data. And that's a good thing, I think, because I mean, this information is sensitive information about individuals. But at the same time, it makes it very difficult for data sharing. I mean, if people come from the outside and try to get access to our systems, we need to figure out a way to do that. And I think that we are now in a position where we have been able to generate, very good information about these individuals, but we now need also to think like a community and see how can we share this information between each other. Yeah.
Sometimes I wonder if the public or the people who actually provide samples for research actually A, know what's really going on, and B, are kind of involved enough in defining some of these decisions. And sometimes I think that they might be more liberal than we think in terms of encouraging things to happen that we might, have concerns about. Do you have any feel in the Swedish population what their opinions are towards genomic research and data sharing?
I think in general people are quite willing to share their information, but we also have something to do here. We need to teach people about what are the benefits of doing this sharing.
Absolutely.
Because I mean, our project in the end, the aim of this whole project is to provide, better medical outcome for patients. So we really need to sort of give this information back to the patients and to the general public and see sort of what is the benefit for them to provide their data to the
that's
research
true.
community.
That's a good point. And to clarify how it works is that when a patient gets diagnosed or has some sort of genetic disease, and we find a variation in their genome that might be explaining that disease, to interpret whether that genetic variation is actually the real cause of the disease, it's critical to be able to search a very large database to see how frequently that same change happens in the general population. And that is what this data will be used for. And until recently, nothing like that has really existed. And so for the clinical community, it's actually proving to be extremely important, as you mentioned.